So since how long this has been like this, Rizwan?
Actually, this I observed after the COVID.
After the COVID?
Yes, I suffered from COVID in 2021 April. And after that, you can say that
It's worsening slowly and slowly?
yeah, I started witnessing pain in my knee the moment I was discharged from the hospital, immediately after that. So,
And you feel this left side is short as well?
yes.
Okay, come. How are the stairs?
I cannot climb stairs.
You cannot climb stairs?
I cannot.
At all?
At all.
At all, okay. So right is more painful.
Right
now,
is more painful.
And left has shortening. Okay. So there's shortening on the left side of about 1 inch. So how much you can bend without pain? Okay. Now we'll check the rotation. If it's painful, tell me. Okay. Pain.
Pain.
Okay. So there's no movement at all. And if I do like this,
That's it. That's it.
that's it. Okay. Now left side bending. So rotation. It's painful. Let me.
It's pain.
Okay. Now, okay, this won't go down.
Don't.
Okay. And how about both legs going apart?
That's it. That's it.
That's it. So no bikes, nothing.
No bikes.
You cannot sit on two
No,
wheeler.
no, no. I cannot.
Okay. तो रिजवान हम इसको बेंड कर रहे हैं. पहले आपको दर्द बहुत रहता था. Now it's completely free.
No, it's all free.
All free. और ये भी कोई मूवमेंट नहीं है. और पहले आपका पैर दूर दूर नहीं जाता
नहीं, अब जाता है.
कोई प्रॉब्लम नहीं होती.
कोई problem.
और पालती लगाने में
कोई प्रॉब्लम.
दिखाओ एक बार पालती लगा के दिखाएंगे. कोई प्रॉब्लम. कंफर्टेबल. और कितने साल नहीं मारी थी पालती ऑपरेशन के पहले?
Almost 2.5 years.
Hi friends, my name is Dr. D.P. Sharma and I am MIS hip consultant, and we are with Rizwan today. Where are you from, Rizwan?
I'm from Delhi.
Delhi. Okay, so what are you facing? What is the issue, and since when are you facing, and how is it messing your life?
Okay, it's a steroid-induced bone necrosis.
Okay.
So I suffered from COVID in 21,
Okay.
and I was treated with these steroids. So
Right. So how long you were given steroids?
I was given steroid for more than 33 days.
More than 33 days. And they used IV also and oral?
IV
also?
and oral both.
Both.
After discharge, I was given this
Oral.
oral steroids.
And in the hospital you were given
IV steroid, solomedrol.
So it's been around more than 1 year, 1.5 years
It's
since you've
almost
been
1.5.
diagnosed.
Yeah.
And now you're walking with limp. There's too much pain.
Yeah, right from the very beginning itself.
The
I
pain is
suffered
too
from-
much.
It's too much, unbearable pain. Even the NSAIDs in my case was not working.
Okay.
So I started with the painkiller gabapentin.
Okay.
So gabapentin reduced to some extent. Then after that, gradually the pain subsided, and I
Right.
took for an Ayurvedic treatment.
Okay.
And that Ayurvedic treatment was initially when I went to the doctors, then they gave me Panchkarma. The Panchkarma really works when it is given in the right way.
Right.
But if you go to I went to another doctor in Kanpur, so that was pure quackery. So you cannot trust them. So after that, I decided I prolonged this so that it could be a natural way.
Right. You
So-
tried and try to heal it with a natural
Yeah.
process.
Not
or
a
some
natural
remedy.
process. To what extent
It can be.
It can be.
You can bear
prolonged.
the pain.
I can bear the pain. Now it's totally not possible. It's an unbearable pain.
It's unbearable.
Unbearable.
So we're planning to do both the hips with direct anterior approach. How did you find the way to us? How many doctors did you consult? What did you why did you choose us?
I consulted a lot of doctors. So the first one was at Indian New Delhi. So I was looking for a surgery that is totally non-invasive.
Right.
The first thing, and the healing is fast. And after that, Since there is a lot of, in the traditional ways, there is a lot of restriction.
Yes.
So we can have a surgery and a replacement done in such a way that those restrictions are not there after the surgery. So
Yes.
all these things is fulfilled by the MIS approach. So I was looking at a number of doctors who are performing this. So I saw you on YouTube, and based on that, I consulted a few people who were operated by you, took their feedback, and finally reached here.
Okay, so what we'll do is we'll just lie down, we'll check the movements just for a record, and we'll compare this after 6 months. Okay? So right is more painful.
Right is more painful.
And left has shortening. Okay? So there's shortening on the left side of about 1 inch. So how much you can bend without pain? Okay. Now we'll check the rotation. If it's painful, tell me, okay? Pain.
Pain.
Okay, so there's no movement at all. And if I do like this,
That's it.
okay. Now left side, bending. So rotation, it's painful. Let me.
It's pain.
Okay. Now, okay, this won't go down.
Don't.
Okay. And how about both legs going apart?
That's it.
That's it. So no bikes, nothing.
No bikes.
You cannot sit on two-wheeler.
No, I cannot.
Okay. Alright. So since how long this has been like this, Rizwan?
Actually, this I observed after the COVID.
After the COVID?
Yes, I suffered from COVID in 2021 April, and after that, you can say that,
It's worsening slowly and slowly.
yeah, it was. I started witnessing pain in my knee the moment I was discharged from the hospital. Immediately after that, so
And you feel this left side is short as well?
yes,
Okay, come. How are the stairs?
I cannot climb stairs.
You cannot climb stairs?
I cannot
At all?
at all.
At all, okay. And since when are you using walker?
The day I was diagnosed with this AVN.
It's been like more than 1 year since you've been. तो रिजवान हम इसको बेंड कर रहे हैं. पहले आपको दर्द बहुत रहता था. नाउ इट्स कम्प्लीटली फ्री.
It's all free.
ऑल फ्री. और ये भी कोई मूवमेंट नहीं है. और पहले आपका पैर दूर नहीं जाता था. कोई प्रॉब्लम नहीं होती. और पालती लगाने में
कोई प्रॉब्लम.
दिखाओ एक बार पालती लगा के दिखाएंगे. कोई प्रॉब्लम. कंफर्टेबल. और कितने साल नहीं मारी थी पालती ऑपरेशन के पहले?
Almost 2.5 years.
2.5. So about 2 years now since your surgery, and you are from little bit medical background as well.
A little bit, not wholly medical background.
Proper medical background से हो आप. And there were lots of doubts, and there are lots of doubts and still in patients. Many of the patients in India are not affording. They can't afford surgeries. And I think some people are using it to their benefit. कि आप ये तेल करा लो, ये सिकाई करा लो, आपकी सर्जरी बच जाएगी. और उसमें टाइम जा रहा है, पैसे जा रहा है. People are selling their houses to get that treatment. How do you consider this? What do you want to say about that?
Look, one should have a scientific approach towards everything. And if you are going to a person for a treatment, he should have valid reason to substantiate whatever claims he is making. Unless and until those claims are not substantiated or proven, just by a word from one mouth to another, we should not buy those arguments as such. So the best part is, if someone cannot afford the surgery cost, let's say if it is 5.5 lakhs, they are going there to a quack and they are paying around 30,000 rupees there
Per sitting.
per sitting.
Yes.
For one sitting, and he will ask them to come again
and
after
again.
3 months. Again 3 months. So let's say 30 multiplied by 3, it costs 90,000. Okay, so if they buy a health insurance plan for 10,000 rupees premium,
Yes.
okay, they may not be able to undertake this surgery because there is a locking period of 2 years.
Yes.
Okay, so in another year, again they renew the plan,
Yes.
and after 2 years they become eligible. So
Yes,
this is
yes.
one way. Just in 20,000 rupees,
You can afford a surgery.
afford a surgery, and that becomes free of cost to them
So
after.
it's such an important point.
It's an important part. So it's the way how we think, how we plan things, and how we perceive things.
Yes.
So we should not be led by from what we hear from one mouth to another.
Yes.
It has to be very much valid and reasonable in thinking, and we have to plan things
Way
accordingly.
ahead in time.
Yes, well in time.
And tell me, we remember how you came, the life you suffered for 2 years, 2.5 years.
It was
And
miserable.
how was it, and as compared to now?
Now, initially, I became almost, since I suffered from AVN, that was all because of COVID. The
Yes.
steroid-induced AVN it was.
Yes.
So, all of a sudden, my mobility reduced, and I could not walk.
Yes.
And whatever things I used to do initially, all came to standstill. And ultimately, it was affecting the quality of life. And since I became totally sedentary, so that was leading towards other health problems also.
And it does affect mental health as well.
Mental health as well.
You're constantly irritated.
Yes, and I was not able to work properly, do anything, that we used to do.
Yes.
So even I heard from one person to another that, okay, the Ayurvedic treatment worked. Actually, if you go to a proper Ayurvedic treatment by a proper doctor, that really works. But it's very, very expensive. For example, if you are spending a Panchkarma treatment and you are taking one Panchkarma for 3,000 rupees,
Yes.
and if you have to recommended around 70 Panchkarmas. So, that treatment, of course, that will work. And even I have taken Panchkarma treatment, and I ended up spending around more than 40,000 there. Then I went to Kanpur, again I spent there 30,000. So if the cost to benefit ratio we look towards a treatment, that is too high.
Yes.
So it depends how much money you have and how much and even if you are taking a Panchkarma treatment and 70 sittings, okay, for some times they may say that, okay, the AVN is reversible and reverses. So what about, okay, if you are all right for 1 year or 2 years, and after that again it comes back, then you cannot go and again spend 30,000 for 70,000-80,000 rupees.
Right.
So it's a never-ending cycle. It's better to look for a permanent solution, and that suits our budget also, and that's it. So it should be planned amicably. But yes, we should avoid all the quacks that we find all around us. They
Are
claim
you,
so
are
many
you
things.
comfortable in
I'm
today's
100%,
life?
I'm 100% comfortable. The
You're
only thing
enjoying
is
your
that,
life.
okay, I enjoy everything. But yes, since the original hip is not there, so ultimately those flexibility that we used to have, that we witnessed over a long period of time since our childhood, so that goes away definitely. But yes, compared to
What you were.
what we were, so
When you
based
came.
on that, yeah, it's really satisfactory.
It's satisfactory.
Very satisfactory.
So Rizwan is from a medical field. वो खुद एक medical profession से हैं and he was suffering from bilateral AVN hip. आप देख पा रहे हो कि he was not even able to walk comfortably with walker. इतनी ख़राब इनकी हालत हो गई थी कि walker से भी नहीं चल पा रहे थे. Why is that we want to delay surgery? देखो ह्यूमन साइकोलॉजी है, हम सर्जरी नहीं कराना चाहते और बिलीव मी हम भी नहीं करना चाहते अगर नेसेसरी नहीं है तो. बट अनफॉर्चुनेटली सम पीपल आर यूजिंग दिस. वो बोलते हैं जो आप सुनना चाहते हैं एंड वी गेट कॉट अप इन द ट्रैप. रिगार्डलेस ऑफ आपका फाइनेंशियल स्टेटस क्या है, हमने जो इकोनॉमिकली वीक हैं और जो फाइनेंशियली स्टेबल हैं सब लोगों को ऐसे ट्रीटमेंट लेते देखा है. हमने जो लोग एजुकेटेड नहीं हैं, जो लोग एजुकेटेड हैं उनको भी ट्रीटमेंट लेते देखा है इस तरीके के. उसका कारण यही है बिकॉज नो वन वांट्स सर्जरी. इवन आई डोंट वांट सर्जरी, बट समटाइम्स वी आर हेल्पलेस और हमारे साथ ऐसी चीज़ हो जाती है. सो वी शुड कंसिडर अ साइंटिफिकली बेस्ड ट्रीटमेंट जो अवेलेबल है, जो हमें क्विकली रिजल्ट दे, हमारी लाइफस्टाइल अच्छी करे. आप देख रहे हो कि बिकनी MIS DAA जो बेस्ट टेक्निक हम करते हैं, वी स्पेशलाइज इन दैट एट सेंटर फॉर हिप सर्जरीज और हम लोग एक हाई वॉल्यूम सेंटर हैं. उनकी लाइफ कम्प्लीटली चेंज हो गई है. यू कैन नॉट इवन से दैट उनकी सर्जरी हुई है. ही इज़ लिविंग अ एब्सोल्युटली नॉर्मल लाइफ.
अगर आप चाहते हो कि आपकी लाइफ भी पेन फ्री हो जाए, यू कैन कंसल्ट विद अस ऑनलाइन ऑल्सो ऑन अ वीडियो कंसल्ट, एंड यू कैन कम टू अस एज वेल. Thank you so much and have a nice day.